basically, one of the main things that you got to be focused on it is how often your horse's teeth has been done. Usually, it's recommended to get it done between the age of 2 to the age of 5 twice a year. Once they reach the age from 5 on, it's recommended to do it once a year.
The reason why you need to do it twice a year is because they're a lot more dynamic. These teeth are shedding, the permanent teeth are coming in, these baby teeth are dropping out, and they also have caps. Go ahead and show what we're talking about here, Victor, as far as caps are concerned.
Well, basically, you can see how some of these caps start falling down, and you will have the permanent teeth start erupting. So all these caps, they start shedding from the age of 2 until the horse reaches the age of 5. So a lot of the times, if these caps don't get removed, they can get stuck, causing in the long run infections, because hay and a lot of debris will accumulate between the permanent tooth and the cap. The diet plays a lot on the horse's teeth maintenance. You know, if you maintain a very healthy diet for your horse, obviously, you know, you're going to maintain a very healthy mouth, which in the long run is going to prevent massive consequences on your horse's dental. One of the main signs that we're looking for is how the horse is masticating or chewing. A lot of the times when it's time to recheck your teeth, the first signs that you're seeing is the horse is dropping feed. We call that quitting. Basically, the horse will eventually drop a lot of the food, like a grain, hay, is one of the most common signs about having a teeth problem.
The biggest complications that can arise right off from not having regular or at least comprehensive dental care on your horse is that you're going to have difficulty with them, you know, procuring food. They'll show you a loss of weight. They'll show you that they become unthrifty. Their hair becomes rough. Their ribs become obvious to you. So they're just not doing well overall. The next thing you see is, obviously, if you're riding, you see behavioral changes and problems with riding and you know, normal, you know, let's say what you normally use your horse for. After that, with time, you'll see potentially problems with colic. You'll see problems with potentially ulcers, different things. So, you know, it can be a big problem, and then you can have the worst thing possible. If you get an abscess or if you get a broken tooth, you can get, you know, an infection up into the sinus cavity, and then you have a lot of complications that end up affecting other tissue systems in the horse's body, respiratory tract, their oral tract, their, you know, mouth, and then, you know, they can basically become very, very sick. And so, you know, it can be something very simple that can be just routine maintenance that can get into an expensive problem that can cost you the use of your horse or potentially its life if you're not careful enough. When you look for someone to take care of your horse's dental, you know, care, typically you'll use a veterinarian to start with. A lot of veterinarians will go ahead and do the dental care themselves. However, like in my practice, I routinely use a technician because they usually have better equipment. They're usually better suited to it. Victor uses both manual and automatic equipment. And we have a lot of success of, you know, using mechanical equipment with proper anesthesia, you know, a little bit of sedative in order to, you know, it would create less work, a lot less damage on the horse, and a lot more efficient dental care. So, you know, usually the vet first, and then, you know, usually other horsemen in your area will utilize a dentist on a regular routine cycle. Sometimes it is a veterinarian that just does dental care. Sometimes it'll be like myself as a regular practitioner that will recommend a technician as well, and we'll work cooperatively with them.